Hello everybody, my name is Dr. Keith Brennan and I'm coming to you from downtown Utica at Back to Health Wellness Center, providing all your chiropractic, massage, and nutrition needs. And today I'm going to be talking about breast cancer awareness, since it is October and it is Breast Cancer Awareness Month. We just had a pink day last week on Thursday in our office, and it generated a lot of different questions. And I don't know if anyone's seen, but Paul Allen just died, I think it was yesterday or the day before, and everyone knows of Steve Jobs. And
You're back live.
Hi, back live. We were paused because of Wi-Fi, so I'm not sure where it left off. So I'm Dr. Keith with Back to Health Wellness Center, talking about breast cancer prevention. We just had a pink day in our office last Thursday, and it generated a lot of different questions. And for anyone who follows the news, Paul Allen just recently died of cancer, I think either yesterday or the day before, and most people are familiar with Steve Jobs, who has passed from cancer. The reason why I point those two gentlemen out, even though they did not have breast cancer, is because I think all of us at some point have been touched directly, indirectly, in a lot of different ways with cancer. So while breast cancer is getting a lot of attention right now, I want to bring awareness to all of cancer, because both of those gentlemen had a ton of money and resources that I think the average person watching this doesn't anywhere come close to. So instead of just talking about what we can do once we have it, there's lots of people talking about that and a lot of really good resources to go to. So I am going to talk about an ounce of prevention is worth a pound of the cure, I believe is the saying. So I'm going to talk about a few preventative things that we can do to hopefully avoid getting that diagnosis of cancer, and even some of these things you can do once you get that terrible diagnosis to aid in what other professional help that you are getting for your cancer. So number one thing is you can do something about what we are eating. Certain foods that we eat can be either alkaline or acidic. The more alkaline foods we eat, the more it can slow down and prevent cancers. So that's the number one thing, and that's why water is also a very, very important part of what we are drinking, because water is very alkaline. Now, to get into more in depth on this, be happy to field any questions, and there's tons of research out there that you can look up online on alkaline versus acidic. Another thing is sugar. Unfortunately, cancer and sugar grow rapidly together. So the more sugar we give our body, the faster and greater cancer proliferates. So we want to reduce the sugar that we are eating for many reasons, like weight loss or maintaining a healthy weight, but also it can directly affect sicknesses as severe as cancer and helping it to slow down the progression. And for most of us, trying to help prevent from ever getting that nasty diagnosis in the first place. The other thing is exercise. Exercise is super important on keeping our immune system strong and helping to keep our bodies nice and strong and healthy to prevent a lot of these diseases. But God forbid we do get one of these diseases, the stronger our body is going into any of these diagnoses, the better our statistics and our outcomes are of coming out the other side. So it is a very sensitive, very tender topic. Those are a couple of different things we can do nutritionally. Another big thing is keeping up on our vitamin D levels, specifically for breast cancer. There has been studies that have shown that a healthy to